Hello, Dr. Keith Hodge with the Monarch Plastic Surgery Minute. I'm joined with Dr. Elizabeth Killion and Dr. Paul Leahy. This is our more in-depth conversation about breast implants. When you come to our office, we want you to get a lot of information. We're going to talk about the preoperative part of the consultation, what happens the day of surgery, as well as aftercare. We're going to talk about the different styles of implants, the different types of implants, as well as the risk of surgery. So it's a really in-depth consultation. We want to answer all your questions so you feel that you're making the most informed decision possible. Dr. Leahy.
Yes, I would definitely agree. We would prefer you to kind of plan and spend some time with us for this consult. It does take a while, and we really want to focus on you, because it doesn't matter what your friend had or your sister had, etc. We want you to get the right match for you. And we try not to focus on how many cc's the implant's going to be. It's truly about the look. I bet we all three would agree with that.
Yeah.
I like to, we probably handle things a little bit differently in our consults, but we're similar, and so when you come in, we'll have you meet our staff, and we'll get to your wishes, and then we'll start talking about the nuts and bolts of what breast augmentation surgery is like, and then we'll cover some issues with the implants, and eventually you'll get some cost information from us, and then we can talk about the next steps in terms of scheduling.
So in terms of trying to determine what look is best for you, this is a time where we really have a lot of options in terms of implant projections. The first thing that we do is the surgeons will pick an implant that fits your chest width, and then we'll pick multiple projections at that breast width that fits your chest, that then you can try on and see how you like it and which look you would prefer. If you want a more lower profile, so a more natural look, or a more ultra high profile, it's going to give you, a really powerful upper fullness, a lot more projection, a lot more kind of oomph.
Yeah, there's kind of some cool photography, gizmos out there on the market that people can use to simulate what an implant might look in your clothes. I've really found that helpful. I really like the person to have the implant, in a non-padded bra, put their different clothes on, and get that feel for it. Do you guys agree with that? Or?
I think that's the most exciting part of the consultation, is when the patient gets to try on the implant with their sports bra. And the way I describe this, I'd be curious what you guys have to say. When we have a moderate profile, I just say this is our really conservative option. It's going to give you more volume, more projection, but a very natural look. It will not give a lot of upper breast fullness. The moderate plus or high profile is going to give you a fuller breast, more volume in the upper pole. And I say our high profile, ultra high profile, is an augmented look. It's going to give you a round breast in or out of a bra. It's going to be a very circular, a very full augmented look, not natural. What do you think?
Right, no, I'd agree. As a matter of fact, probably that means that this is going to be our most commonly used implant.
Yes.
You might go either way just depending upon the patient, right?
No, absolutely.
Yeah. Sorry. So I can real quickly touch on saline versus silicone.
Yeah.
We've always had the water-filled or saltwater-filled saline implants around. There's some good things about them. There's some not so good things about them. They definitely are going to feel less lifelike than our current state-of-the-art silicone gels are. But they're still out there, and there's some variations of the saline implants, like we mentioned on our other video. In addition to the saline-filled implants, probably the more common devices really today are going to be the silicone gel type implants, and that's come a big way in terms of technology and really in safety, but also in feel. You'll have to just come try these implants for yourself. They're amazingly lifelike, but to me, the biggest advance with silicone implants is going to be the cohesive silicone. It's almost like cutting a gummy bear candy in two pieces, and when you took two pieces of the gummy bear candy, you could squeeze it and run over with your car, throw it on the wall, you pick it up, it still looks like you have two pieces of an apple, basically. Matter of fact, I have an old video of Dr. Hodge running over one with his car, but that implant's still around. So anyway, that's kind of what I would say the majority of our practice has kind of gone towards those types of implants.
I agree. The other thing that a lot of patients ask is, do I have to change them out every 10 years? I think that was just kind of an older mantra that was really imposed by this idea of the implant warranty, and it's like, well, it's out of warranty, therefore I need to change it. And I don't personally adhere to that. I don't know if y'all do, but I think our kind of approach is, if you're not having a problem with it, then we don't feel that you need to change it out at a set time period. If you're doing great, awesome, go and live your life. We do have some ways to screen for rupture if you have a gel implant in place, because again, it's a cohesive implant, and if you have a rupture, you wouldn't necessarily know it. And that would be a specific imaging, but again, if you're not having a problem, then we typically say, then we just continue to monitor you regularly and don't recommend just prophylactic changing them out.
I do like to see our folks, almost every year if you can, just so you can keep up to date, but sometimes people aren't able to do that, so.
Yeah, I would say a screening mammogram is going to pick up a lot of the ruptures, the silent ruptures. But with today's technology being so cohesive, I'm not sure a mammogram is actually going to pick that up. It may take an MRI or CT to pick it up because the cohesivity that Dr. Leahy mentioned. But the great thing about it is even though it's cohesive, it's so soft, it feels so natural. That's why I love these implants.
Oh, definitely, yeah.
And I tell my patients, with this technology, you may only need one exchange your entire lifetime, because these are definitely going to last longer than 10 years, like Dr. Killion said. So I'm really excited about these implants.
So do you guys want to talk about kind of the basics of the surgery a little bit? So the first thing I always talk about is you got to make an incision somewhere, right, to get this implant in. And I think probably the three of us are almost fairly commonly underneath the breast in the fold. There's some other ways you can do it. Talk about above and below the muscle a little bit.
But I have a lot of people ask me, like, why do you go at the crease? And I would say because the silicone technology requires that the implant comes pre-filled. In the old days of saline, you would remove the air from the implant, insert the implant, and then reinflate it. So you could literally roll the implant up and put it in. So you had different options that were probably just as good as the crease incision. But with the implants coming pre-filled, I need to make an infrared fold incision to have an incision big enough to accommodate the pre-filled implant. So
Definitely,
almost always.
The other thing is
crease.
that it's a lot safer incision and approach to use. It's associated with less risks. And that's always our goal, is to make sure that you have a safe surgery as well.
And better symmetry.
Yeah.
You can get that too. It seems like there's less trouble with losing sensation to the nipple, a little bit less with that incision. How about above and below the muscle? I'm personally probably about 98% or so under the muscle. There are certain situations where I might recommend going above the muscle. For me, it would be somebody who is like maybe a competitive bodybuilder, and if you're going to be up on stage and flexing and you don't have any fatty tissue or really any breast tissue, then that's going to look weird under the muscle, or it can. So I might recommend going above in that situation. Do you guys have other times that you might recommend?
That's the most common reason I would go above the muscle. And what Dr. Leahy's describing is you can have something called animation deformity. So when you flex your pectoralis muscle, which is your chest muscle, you can actually move the implant. So if you're on stage posing, flexing, it can make your breast look a little odd when you're doing that. So I would definitely at least have the discussion about going in front of the muscle. I think going in front of the muscle has other advantages, much less downtime. You're not going to be very sore.
Yeah, that's true.
Going in front of the muscle, so less downtime and no risk of animation deformity. But the big downside is increased risk of capsular contracture. We've not talked about it yet.
Right, we haven't really covered that. So that's a condition, capsular contracture. So every implant that gets put into a body of any kind, it could be a pacemaker, it could be a breast implant, it could be a knee joint, your body will wall that thing off. It doesn't belong there, so you get this real thin, wall of kind of like a membrane that blocks that from the body. But in some situations, the reason we don't 100% know why, some people will get some thickening of that capsule. So people come in and say, well, I heard of someone whose implant got hard and hard like as a rock. That's not what happened. The scar is what got hard. The implant, you take it out, it's perfectly fine. So anyway, when it's on top of the muscle, we do see that risk a little bit higher than underneath the muscle. Would you agree with that?
Yes.
Mhm.
Yes. Some people say that if you go underneath the muscle, you have the same amount of contraction, but it's just camouflaged more.
That could be too.
I don't know, but I think definitely if it's camouflaged, then we can't know that it's there. So
It's not a problem.
Yeah, therefore better. I always look at their upper pole pinch and then talk to them if they have good upper pole pinch is just a technique that we do just to look at how much upper pole breast tissue you have. And if you've got over 2 centimeters, then typically you can go on top of the muscle and the upper pole of your implant will be camouflaged. But if you don't, then you're going to be able to really see the border of your implant at the top of your chest, and most people don't want that look, and so going underneath the muscle will give you a lot more camouflage.
Probably the next most common question I get is, what's my downtime? What's recovery like? What do you say when someone just generally asks you that question? What do you say for breast augmentation?
I would say that most of my patients are off pain medicine in 3 to 5 days, but they're gonna feel sore for the first week or two. And I ask that they not work out upper body at least for the first month.
That's what I say too, almost exactly, yeah.
And then the other thing to know is that at first your implant, especially if your implant's underneath the muscle, is going to appear very high. And it takes several weeks for it to drop, and we'll work with you in terms of maneuvers on how to keep your implant in the appropriate position. But I think that's just an important thing to be aware of. That's going to appear abnormally high for those first few weeks.
So that's a great point, talking about how the implants are high for a while. That is one question that we get almost very commonly the day of surgery. So got to remind people of that. The other thing we get calls about is, oh my gosh, I hear little tiny air bubbles around my implant. I think there's a problem, and nothing wrong. That is the soapy irrigation, the wash that we use around your implants to help protect you. And so that takes a while to get absorbed, but you will hear that move around and slosh a little bit for a while. So we thought next week maybe we should talk a little bit about just some other things to know about in terms of risks or issues with the operation.
I think the capsule is one of the most important things people need to be aware of. You have about a 1% chance of developing a capsule. And the theory is that even though we're doing a sterile procedure and a sterile technique, the breast is not a sterile organ. So you can have some bacteria in the pocket you're creating. So to avoid that, the first thing we do is put a sterile dressing over the nipple so that the bacteria cannot leak from the ducts. And secondly, we irrigate the pocket like Dr. Leahy was talking about. The bubbles you feel or hear are remnants of the antibiotic irrigation and the betadine irrigation that we use to irrigate the pocket to eradicate any of the bacteria in the pocket. And other risks I would talk about include some numbness, which should be temporary. The nerves are being stretched to make the pocket itself. And so it's very common to have a little numbness from the nipple down the inferior part of the breast initially. That should be temporary. There's always a small risk that could be a permanent change. And I tell my patients, if you want the biggest implant possible you can accommodate, you may have to accept some permanent numbness. But if we put in something proportional, that should be temporary. No implant is a lifetime device that we kind of talked about. At some point you need to change. And so there's very good warranties out there now, but no implant is a lifetime device. Other risks are persistent asymmetry. No 2 breasts are identical. You're never going to have identical breasts. We're going to enhance your shape, enhance your volume with the implant, but there'll always be a little bit of asymmetry. Other than that, small risk of bleeding, a small risk of infection, a small risk of anesthetic complication, those are all very minor risks. You guys think of anything else?
I always just think about, it's don't come in with a certain cup size in mind, because it depends on who makes the bra, where you shop, and so it's really, again, like I said earlier, about the look. But you touched on all the big issues we see.
Absolutely, and I think it's important to be aware of different asymmetries between your breasts, specifically in terms of your nipple position, because that will be accentuated at a higher breast volume. And so that might be something that you might want to think about correcting at the same time or potentially down the road as well.
I guess the last thing I might say is that we plan for another video to talk about breast lifting and how that might sometimes be paired up with augmentation, and might be by itself as well. So we got some other plans coming your way for videos and things, but I think that's the basics of the breast augmentation process. So we really look forward to seeing you. Please call, email, whatever we'll get you in to see one of us. So.
Okay guys, thanks for watching. Bye.
Thanks.